Bismillahirrahmanirrahim. Assalamu alaikum. Welcome to Neurology Made Easy. Today, the topic we are going to discuss is drugs for glaucoma. So, glaucoma is a disease of eye in which the intraocular pressure is raised. So, first, we will go through the basic pathophysiology. So, here you see this is the what I am marking is ciliary body, and this is the epithelium of ciliary body. Here, I have mentioned the epithelium of ciliary body. What happened that the blood vessel, it has blood plasma and the cells. So the plasma is secreted from moves from the blood vessel into the SNS and later into duct, and from here there is modification of plasma, and this is the eventually the aqueous humor. The aqueous humor that is produced here, it then moves to the uh, anterior chamber, and finally it is drained through the canal of Schlemm. So, this is the normal pathway. But what happens in glaucoma is that this angle between the iris and the iris and the cornea, it is obstructed or reduced. So the proper drainage of aqueous humor does not occur, leading to increased intraocular pressure. So we have some drugs. Some of the drugs, they help us to reduce the secretion of aqueous humor, and these include alpha 1 agonist, beta blockers, alpha 2 agonist, and carbonic anhydrase inhibitor. And then there is another group that increase the outflow of the aqueous humor, and these are the cholinomimetics or muscarinic, M3 agonist, and prostaglandins. So how this happens? Now, when we talk about the decreased secretions, first we consider this alpha 1 agonist. So, you know that alpha 1 agonist cause vasoconstriction of the blood vessel. When there will be vasoconstriction of the blood vessel, less plasma will move into this SNS, and hence there will be reduced aqueous humor secretion. The next thing, so we use alpha 1 agonist. The next thing is that this epithelium has beta receptors, and beta receptors are involved in the secretion of aqueous humor. So when we use beta blocker, then there is again reduced secretion of aqueous humor. The alpha 2 agonist, they inhibit the secretion of aqueous humor. So then either we can use beta blockers or alpha 2 agonists, so that the secretion of aqueous humor is reduced. The fourth drug in this group is carbonic anhydrase inhibitor. Carbonic anhydrase inhibitor is a diuretic, and these diuretic, what they do in diuretic, there is move the water and electrolytes out of the body. So when there will be less volume, less blood volume, there will be when there will be less blood volume, then there will be a less plasma secretion into this SNS, and hence reduce aqueous humor secretion. So it was easy that first we reduce the secretion of the aqueous humor, either by using alpha 1 agonist that causes vasoconstriction, carbonic anhydrase inhibitor that is a diuretic, reduce aqueous humor secretion through beta blockers, or alpha 2 agonist. The next thing is that we can also increase the outflow. What we can do is these muscarinic receptor, they are involved in the constriction of these constrictor pupillae muscle. So when there is constriction of this pupillae muscle, this muscle moves a bit here, and hence this angle will be a bit widened, and it will be easy for the aqueous humor to move into the canal of Schlemm. The next thing is that prostaglandin F2 agonists, they are also involved in increasing this angle, and hence increase the outflow of the aqueous humor. So this was all about glaucoma drugs. If you make these two groups And then you see upper half, they are involved in reduced secretion. Alpha 1 agonist, alpha 2 agonist, beta blocker, and carbonic anhydrase inhibitor. A, this is, you can say, A, B, C. Alpha 1 and alpha 2 agonist, beta blockers, and carbonic anhydrase inhibitor. And these two, these are MP. Muscarinic drugs or cholinergic drugs and prostaglandin. They increase the outflow of the aqueous humor. So this was all about drugs of glaucoma. I have tried to make it very easy. I hope you understand it. If you have any question, you can write in the chat. Like, share, and subscribe. And see you in the next video. Tafis.